Exciting news today, two announcements that could change the face of the care that you get in your GP's surgery, and also a non-hormonal treatment for some of your worst menopause-related symptoms. Welcome to my channel. My name is Kate and I share a weekly video with you every Monday around something related to menopause. Today is very news specific and I'm really excited to share more about it. Firstly, I'm going to dive into an app that is only in a clinical setting. So basically it's something that doctors, GPs, healthcare providers can refer to in order to help them give you probably an improved response around your menopause related issues. It was developed at University College London Hospitals, integrating NICE and the Menopause Society guidelines into clear step-by-step recommendations that your GP can offer you during your consultation. So it's not something that you can personally use yourself, but it's going to be really helpful for those GPs who aren't that well trained in menopause. My private health and wellness group, I have a few, they're called menopause specialists within the NHS framework. And they came to join my group to learn more about menopause. Possibly more the holistic side of menopause, because this app, it's only clinically based. So it won't be giving you the holistic things that you can do, you know, the lifestyle things that will support your menopause journey, no matter whether you take HRT or not. Lifestyle is key. And I know it's something I bang on about all the time, but this app is going to be really helpful because during the consultation, the GP will add in very, very detailed information about your current situation, your symptoms, your medical history, your cancer risk, any bleeding issues, and it will generate tailored recommendations and in some cases over-the-counter recommendations that then you can go and get. It's not AI, it's not based upon algorithmic computations. There are a few public facing apps out there, and when I was doing my research for this, there's quite a few, and to be honest, I think they're a little bit dubious, but there are a few out there too. I think Dr. Louise Newson's got one. That might be a more safe one to dive into if you're looking for an app that, you know, offers you that menopause advice, but also more of a holistic feel to it as well. But with all these apps, to get the really detailed information, I think you need to pay for the premium tiers. I'm not entirely sure, I don't use those apps myself, but if you're wanting to get an app that you could personally use, perhaps try the Balance app or explore the Balance app by Dr. Louise Newson. So this clinical app rolled out on my birthday, the 23rd of July, and it's seen really positive uptake by GPs across the NHS because it allows personalised menopause care in pretty much a click. The good thing about this is it's going to reduce the wait time for specialist menopause referrals, and it does help with GP confidence in prescribing hormonal and also non-hormonal options to you. Added a load of references in the description below, so if you want to go and read those, the press coverage, etc., you can dive into those in a bit more detail. The really exciting news is that there is a new non-hormonal treatment for hot flushes, hot flashes, night sweats, and possibly sleep problems associated with menopause. Non-HRT. So for those of you who don't want to take it, like me, who can't take it, if you've got the BRCA2 gene, you're higher risk of developing blood clots, you have a higher risk of breast cancer, even if you're currently taking cancer therapy, apparently this is approved to be safely used alongside that therapy, and it's known as Linquate in the UK. The drug used right now called Veoza. The thing with Veoza is there is evidence to suggest it might cause liver damage and also endometrial lining damage. So the Elinzanetant is actually really powerful potential new drug that's only been released in the UK so far. We're the absolute first country in the world to put it out there for general use within the NHS, but it does need a prescription. It's currently being approved for rollout in the US and Australia, and I would imagine around the rest of the world too. There's a little bit of a caveat in the US whether or not insurance companies will require in most parts for you to have already tried HRT and or antidepressants to help with your hot flushes or indeed sleep issues. The conventional therapies right now are HRT and or SSRIs, antidepressants. But not all of us want to take HRT, not all of us can take HRT, and SSRIs, obviously they're an antidepressant and they come with their own side effects. And do you really want to be taking antidepressants because you have hot flushes or hot flashes? Just a quick caveat on that as well. Lifestyle has the most profound impact on your hot flushes. Hot flushes, night sweats were two of my absolute worst symptoms of the menopause, perimenopause. And as the more I learnt and the more I started to track what I was doing and eating and drinking the right stuff for a healthy lifestyle, and also trying to manage my stress as much as possible, I got serious hot flushes. I mean, literally sweat zones. It would drip off me down to just 1 in the morning when I woke up, when we have like a natural cortisol surge. So lifestyle is huge in helping you manage your hot flushes and hot flashes. Never ever discount what you can do yourself. However, there probably are some people out there who've tried all the lifestyle stuff and are really still stuck with their night sweats, hot flushes, and also the insomnia, because they're all sort of interrelated. Elinzanetant could be an absolute breakthrough for so many women, because 80% of women have hot flushes, hot flashes. A third of those have really serious hot flushes and hot flashes. I think I would fall into that third category, because literally, I promise you, I would drip. When my hot flashes first started, I could feel sweat rolling down my back in literally seconds. I would have to change my bedding every day because of night sweats. I had to change my clothing in bed, and I had to start to wear clothing in bed, so I'd have something to mop up the sweat and lie on a towel. It was vile. If I knew then what I know now, it would have had a profound impact on those hot flushes. And I know now, even if I, start eating the wrong stuff and drinking the wrong stuff and not having enough water, I can then still get really a lot of hot flushes. And I'm going through a very stressful period in my life at the moment. And while my lifestyle's pretty healthy, because of that elevated cortisol level, I'm still waking up really sweaty at times. And I know once lifestyle, calms back down again, that will subside. So a lot of it is stress related. And there's only so much that we can manage ourselves. And of course, if you're waking up several times a night, if you're in a season of stress yourself, it could be a really healthy adjunct to your lifestyle things that you're already doing. There were 4 main trials, OASIS 1, 2, 3, and 4, across 77 different sites, and it was multinational. So it was a pretty big trial. I'll add references in the description box below for you to further explore if you want to. And the studies demonstrated that a dose of around 120 milligrams of Elinzanetant would have an effective response on reducing your hot flashes, night sweats. The trial OASIS 4 was for breast cancer only patients. It was a year-long trial, and around about 70% of breast cancer patients achieved around about a 50% reduction in hot flushes, night sweats, and an improvement in their sleep. One thing to note is that if you take Elinzanetant, it's likely to have a big impact on hot flushes, night sweats, and hopefully your sleep too. But it will not do the things that HRT promises, as in improve your bone density, improve your blood lipid profile, improve your vaginal health, improve your brain cognition. I did quite an in-depth video a couple of weeks back now around the guidelines on UTIs and topical vaginal estrogen therapy. So if you've not watched that, I would definitely catch that, because that goes into your vaginal health in a lot of detail. And again, that was fairly recently announced guidelines. So I will link that in the description box below, and I will endeavour to get a link up here too, so that you can click that. Just right click it, then you can finish this video off and then go on into that next video if you're interested. The side effects are listed pretty much just as headaches and fatigue, possibly a little bit of sleepiness. And while you do need a prescription for it in the UK to get hold of Elinzanetant, it could be an absolute game changer for you if you don't want to take HRT, if you can't take HRT, and if you're struggling with hot flashes and insomnia. There is a phase 2 Nirvana trial undergoing at the moment, which is the one diving deeper into the sleep issues, which uses polysomnography to objectively monitor Elinzanetant's effect on sleep disturbances, which is just so important because, if you've had poor sleep over a long period of time, it has such a negative impact on so many other aspects of your life. So even if you don't get the hot flashes or the night sweats, it might be something that you could use to help support your journey through the menopause if you're struggling with frequent waking and insomnia, or indeed going to sleep once you get to bed. I'm really excited about the ways things seem to be progressing out there. There's greater transparent, or there's greater appreciation that traditional doctor's education doesn't dive into menopause in enough detail, nor does it dive into nutrition in any real detail either. So the fact that GPs now have access to this app is really going to help them provide you with better care. But this Elinzanetant release, I think, is groundbreaking and could have such a profound impact on so many of you out there. I have a few friends who are currently on breast cancer treatment. They've had hysterectomies, they've had the oophorectomy, they've got the BRCA2 gene, and this could be something that would have such a profound impact on them. Plus, also give you a sense of control. So if you really are struggling with the hot flushes, maybe you've had the hysterectomy, the oophorectomy, and all of a sudden you've been plunged into the aftermath of a surgically induced menopause. This also could be something that's so powerful because you're not going to suddenly end up with those hot sweats, and it's just vile. When you get them badly, it is really, really debilitating. And most of them always seem to happen in a public place. And like I say, stress can bring them on too. So if you're at all nervous, if you're working, you have to stand up and talk in meetings. I work from home, so those would not be such a great impact on me nowadays. But if you're in an office and you're having serious sweat episodes, they are really, really uncomfortable. Plus, it's unlikely you've brought a whole change of clothing in order to be able to go and put something dry on. Plus, you may not have access to showers. So the fact that this new drug has been released, it's been approved, please, if you struggle with your hot flashes, your night sweats, possibly in your insomnia, although obviously those trials are still ongoing, it is worth talking to your healthcare provider because they might be able to issue you with the prescription that can transform how you navigate your daily life through menopause and beyond. So I will look forward to catching you again next week. Have a fabulous week and thank you so much for your company. And I will talk to you again soon.